Hello everybody, greeting from my side. Today I really want to explain this whole concept of metabolic therapy or metabolonomics, what we say. Yes, this is the new thing and there's a lot of work which is happening on metabolic therapy of cancer treatment. But what is metabolic therapy? Metabolic therapy is to understand how the cancer is metabolizing, that is whether it's how it's developing new cancer cells, how what is the energy source, whether it's glucose or glutamine or fat driven or all three of that. Is it the treatment of choice? First of all, I want to make one thing very clear that this is not an alternative to standard of care. Neither it is an alternative to surgery, chemotherapy or radiation. Surgery, chemotherapy, radiation, these are the modalities which are able to kill the cancer cells. So we cannot do away without them. That's for sure. Yes, there is a issue that are we able to cure all cancers by them? No, we are not able to cure all cancers by them. Does cancer have a recurrence even after surgery, chemo, radiation? Yes, it has a recurrence, or it may be left behind. And what is metabolics? Metabolonomics is that we understand how the cancer is metabolizing, how it is spreading, how and what is the energy source, and we cut those things for it. So if cancer for that matter is having a high glycolytic index, majority of cancers does have it, but some of them do not have it. So we should understand the metabolic signature of that. And if we start those patients on fasting, keto diet, will it benefit? Yes, it will benefit. But we have to be sure when the patient is on chemotherapy, whether the patient is recovering or not. It should not happen that patient is already weak and we put that patient on a low glycemic or a fasting, that the normal cell functions also go deranged. So what we exactly do in the metabolic therapy is we understand the metabolic signature of the cancer. There are certain tests which are available which help us to understand that. It's like NGS, like RGCC based transcriptomics. So we are able to exactly pinpoint what are the cancer pathways, how the cancer feeds. So what we do is then we use the alternative or the integrative, or when we say complementary and alternative medicines, in which we are using off-label medicines like high-dose vitamin C, artesunate. We are using nutraceuticals like curcumin, quercetin, genistein, EGCG. We are also looking at what the diet should, whether the patient should be on low glycemic or whether the patient should go completely vegan so that the glutamine source is cut. So all these things then we integrate with the standard of care. So when the patient is having a high load of cancer, when we are looking at using the standard of care, then we integrate that with the standard of care. And once the cancer load or is down or the cancer is cured off, then we are able to put the patient on completely metabolic therapy so that the recurrence can be prevented. So that is how this exact role of metabolic therapy is. And I would really advise all those who are looking at metabolic therapies is to please understand and ask your doctors to understand the cancer signature, then look into metabolonomics. Just don't follow it blindly. If you follow it blindly, it might cause more harm rather than benefit. Like supposedly, if I'm using a high dose vitamin C, so I need to understand the beta half-life of chemotherapy. So I'll put high dose vitamin C, pro-oxidants like vitamin C, even if I'm using an HBOT during this beta half-life of my cytotoxic chemotherapy. And then when I'm using the antioxidants like curcumin, quercetin, genistein, EGCG, berberine and all, then I would put it after that half-life so that they decrease the resistance, they decrease the cancer metabolism, the cancer becomes weak, and when we go for the next cycle of chemotherapy or radiation, it basically there's a weak cancer and the response is much better. But if we don't do it scientifically, then I would actually cause harm rather than benefit. So this is a basic concept of metabolonomics. We'll delve more in our subsequent videos, but my first suggestion is that if the patient is a naive patient, that the cancer is recently diagnosed and the knowledge of metabolonomics is limited, please just follow the standard of care. And it might be that the patient gets cured from that. And If you're looking at metabolism, we need to get all these scientific data, and then we need to plan it. And secondly, if the cancer is a recurrent cancer, the cancer has come back, then definitely we have to integrate the metabolomics with the standard of care. Otherwise, second line chemotherapy, re-radiation, salvage surgeries are very difficult procedures, are very morbid procedures, and in spite of such high morbidity and difficulty, still there's a very high chance that we'll not be able to cure the cancer. So metabolomics will play a very important and integrated role in having an adequate cancer control. So I just want to give one message. Yes, metabolomics is a very good method. It has a great substance to use in cancer treatment, but it has to be used in a right way. Thank you.